I'm Daryl Thompson. I'm founder of Global Research and Discovery Group Sciences and also the advanced research team BioQuest. In the past, we've created a lot of new discoveries that I believe will advance cancer therapy research. However, we're about ready to engage in a new important project, a moonshot, if you will, in which we seek to adapt and tap into an immunity for fighting cancer. Our previous cancer therapeutic, Linebacker, was highly successful. The objective of Linebacker was to increase the therapeutic value of the top cancer drugs in the world: Taxol, doxorubicin, topotecan, and cisplatin. The drugs worked fairly well, but for instance did not have complete inhibitory values. During the project, we discovered an effect that we named CRST1, in which we can inhibit the growth potentials of cancer. The result was it increased the efficacy of the top 4 cancer drugs, literally off the charts. Cisplatin had a 23% inhibition. Taxol would inhibit around 42%. Doxorubicin, roughly around 52%. And topotecan would inhibit generally around 58%. Combined with Linebacker, we saw a dramatic increase in the efficacy of these compounds. Cisplatin combined with Linebacker had an increase of inhibition up to 82%. Taxol saw an inhibition increase to 75%. Doxorubicin, 87%. Topotecan had an increase up to 97% inhibition. During these assays, in which we ran 10 cancer cell lines against 80 different variations, the inhibition means that you're inhibiting growth. So if you're inhibiting anything over 51%, you're not slowing cancer, you're inhibiting its growth. So like with the case with topotecan, inhibiting the growth of cancer at 97% means we're literally inhibiting almost complete growth of the cancer cell. The goal of this project will be to find a particular molecule that can tap into the innate immune system to locate cancer. This is your T cells and your beta cells. The T cells attack, the beta cells remember. If we do this and everything's successful, we should be able to find something that we can prime the immune system to recognize cancer before it even begins. There was an interesting side effect after the outbreak of COVID in which that it caused a dynamic shift in how research is actually performed. The old days, it used to be phase 2 or 3 before a drug was deemed valuable. Today, during the urgency to develop new drugs, a renaissance has appeared in the drug discovery business, in which the discovery phase or early phase is the most valuable today, with 95% of most discoveries accelerated past what we saw 5 to 10 years ago. Our next research project is expected to be a major breakthrough in the world of cancer research, but our usual methods take a lot of time and suffer from bureaucratic red tape. We want to get this past the discovery phase and into the developmental research phase as soon as possible. With our new project, MS1, we could do what we've done in the past, spend years in the bureaucratic process and working through all the red tape in order to perform the tests that we actually need, or we could fast track things, get the funding, go straight to the important tests so we can prove the efficacy of MS1 treatments and get this compound into the hands of a major pharmaceutical company as soon as possible. Your support for this important research project will allow us to push the MS1 vaccine research to its limits. We look forward to bypass the bureaucracy that exists today and enable us to perform the essential studies that will push this into the discovery phase.